All right, let's talk about a tiny gland that runs the show for your entire body, your thyroid. If you've been given medication for it, the whole goal is simple, to get your body back into balance. So today, we're going to dive into how these medications actually work to get you there.
You know that feeling? Just completely drained, cold, and slow? Or maybe you're on the other end of the spectrum, all jittery, anxious, heart pounding for no reason? Well, those feelings might not just be random. They could actually be signals coming from that little butterfly-shaped gland right in your neck.
So let's get to know this gland. The easiest way to think about your thyroid is like it's the thermostat for your body's engine. That engine is your metabolism. The thyroid's job is to release just the right amount of hormone to keep everything running at the perfect speed. Not too hot, not too cold. Just right.
But, sometimes that thermostat breaks. If it's set way too low, your engine runs cold. That's hypothyroidism. Everything slows down, you get the fatigue, the weight gain, that constant chill. But if the engine starts overheating, that's hyperthyroidism. Your metabolism goes into overdrive, and you're left with anxiety, weight loss, and a racing heart. Both are about being out of balance, and that's where medication steps in.
Okay, so what do you do when the engine is running cold? Simple, right? You got to top up the fuel. When you have an underactive thyroid, hypothyroidism, the medication is designed to do just that. It's literally replacing the hormone that your body isn't making enough of on its own.
And the main medication for that is called levothyroxine. All it is really is a man-made version of T4, which is one of the key hormones your thyroid produces naturally. It's the go-to treatment pretty much everywhere because it's a super reliable way to top up those hormone levels and get your body's engine humming along like it should.
Now check this out. Levothyroxine has what's called a half-life of 7 days. That's a really long time for a medication. And what it means is, after you take just one dose, it takes a whole week for only half of that dose to work its way out of your system. And this has huge implications for how you're going to feel when you start.
And this is exactly why you won't feel a big burst of energy after your first pill, or even your fifth. Because of that super long half-life, the medicine has to build up in your system really slowly and steadily. It usually takes a good 4 to 6 weeks to hit that stable level where you really feel the full benefits. So the biggest piece of advice here, you have got to be patient. It's a marathon, not a sprint.
All right, let's flip the script. What happens if your engine is overheating? With an overactive thyroid or hyperthyroidism, we're not trying to add fuel, we're trying to gently tap the brakes. The medications for this condition work by telling your thyroid to just slow down and stop making so much hormone.
So the two main brake medications are methimazole and PTU. And your doctor will pick one for very specific reasons. Methimazole is usually the first choice because, hey, it's just a once-a-day pill, which is super convenient. But PTU has its moments to shine. It's the go-to during the first trimester of pregnancy, and it's also really useful in a rare but serious emergency called a thyroid storm, because it has this extra little braking power that methimazole doesn't. Now, sometimes a doctor needs to slam on the brakes, hard and fast, but just for a little while. That's where something called an iodide solution comes in, like Lugol's or SSKI. These aren't your long-term solution. They're used for quick, powerful control of severe symptoms, usually to get someone ready for thyroid surgery by calming the gland down and making it less bloody.
Okay, this next part might be the most practical bit of our whole chat. Knowing what your medicine does is one thing. Knowing how to take it correctly, that's the real game changer. So think of this as your essential user manual for making sure you get this right.
If you're on levothyroxine, this morning ritual is, and I mean this, non-negotiable. First step. Take it the second you wake up on a totally empty stomach. Step 2, wash it down with a big, full glass of plain old water. And step 3, and I know this is the hardest one for a lot of us, you have to wait at least 30, but preferably 60 minutes before you have anything else. No food, and yes, no coffee.
And it's not just about the morning routine. There are a few other things that can seriously mess with your levothyroxine absorption. The rule here is simple. Keep a 4-hour gap between your thyroid pill and things like calcium or iron supplements, a lot of antacids, and even some foods that are super high in fiber. Just giving them that space ensures your body can actually use the full dose of the medicine you're taking.
Okay, let's move into our last, and I'd argue, most important section, the safety check-in. Getting back to balance means knowing how to stay in that sweet spot and what to watch out for. This is where you really become the MVP of your own healthcare team. This chart shows the whole goal perfectly. With levothyroxine, if your dose is too low, well, you're still going to feel all those sluggish, hypothyroid symptoms. But if the dose is too high, you can actually swing yourself into hyperthyroidism with the anxiety and the racing heart. The goal is to land smack in the middle of that just right zone, and that's exactly why you need regular blood tests to dial it in.
Now, for anyone taking those brake medications, methimazole or PTU, we have to talk about a very rare but very serious side effect. I really need you to pay close attention right here. This is critical. So here's the deal. There's a condition called agranulocytosis. Forget the big word. What it means is your white blood cell count can plummet, and you lose your ability to fight infections. The warning signs you need to watch for are a fever combined with a really, really bad sore throat. If you get that combo, don't just hope it goes away. You need to call your doctor immediately.
There's a second, also rare, risk of liver inflammation or hepatitis that's seen a bit more with PTU. The signs here are different. We're talking about weird nausea that won't quit, a deep sense of fatigue, or pain in your belly. Just like before, these are your body's alarm bells. It means stop the med and call your doctor right away.
So after covering all of this, the mechanics of how these drugs work, the rules for taking them, the serious warnings, what is the one crucial thing you need to take away from all this?
Here it is. Your medication is a tool to help your body find its balance again. And being consistent every single day is what makes that tool work. But the real secret? It's you. You are the most important person on your healthcare team. When you pay attention to your symptoms and talk openly with your doctor, you're not just a patient, you're a partner. And finding that perfect balance, that's not just about the pill. It's about the partnership. Thanks for joining me for this explainer.